Thank you for watching. In COVID patients, the severity of disease can be assessed by CBC. The most common findings in patients with severe disease is lymphopenia, and you will find low lymphocyte count. Side by side, you will find neutrophilia. Yes, neutrophils count will be much increased, and sometimes platelets count is also reduced in patients with severe disease. So if you find neutrophils count increase with low lymphocytes and platelets, this picture is known as bicytopenia, and this reflects severity of disease. Then high serum ferritin levels, high C-reactive protein, elevated LDH levels and D-dimers, they all reflect the severity of disease. If these levels are not coming down, your patient needs intensive care, as such patients are critically ill and their increased plasma levels of all these inflammatory markers suggest potential immune dysregulation, and with increased neutrophilia, low lymphocytes count, increased D-dimer, increased ferritin and LDH and procalcitonin, you can expect cytokine storm in such patients. In the early phase, plain X-ray films may not help you a lot, and the study may be unremarkable, but HRCT may be helpful, showing bilateral peripheral ground glass opacities. But this is important to mention that in some patients with initial 2 to 3 days of infection, you may not find these opacities. So chest radiograph alone is not recommended for the diagnosis. So summary up till here is, in severe cases, CBC will be showing neutrophilia, lymphopenia, increased ferritin, increased CRP, increased LDH and D-dimer. D-dimer may be high, but it may be normal as well. CT scan of chest may show ground glass opacities with bilateral consolidation. Now, few words about detection of SARS coronavirus 2 RNA by reverse transcription polymerase chain reaction, which is commonly known as RT-PCR. The samples are taken from nasopharynx and throat. In my clinical practice during the second wave of COVID-19, I have seen many false negative cases of RT-PCR. But in spite of this, you should go for all these tests in a patient who is complaining of fever with rigors, sore throat, shortness of breath, cough, flu-like symptoms, severe body aches and pains, and loss of smell and taste. And not only loss of smell, but sense of smell may be exaggerated in some patients. So patients with low oxygen saturation, they also need immediate hospitalization. Antibodies, IgG tests, can help to know whether this patient was previously infected with COVID-19 or not. And you can watch a detailed video of mine on antibody testing, and the link is there in the description of this video. So this is all about common laboratory findings in COVID patients. I hope this will be of some help to my fellow physicians. Thank you for watching.